Good afternoon and welcome to our monthly Dementia Lecture Series. My name is Alice Cooper. I'm one of the clinical social workers in the Cognitive Neurology Clinic. I'm joined by my colleagues Ashley Varner and Debbie Arnold. We'll also be joined later on by some of our IMC clinical social workers also. Today, this is a series that is focused on different topics that touch the lives of our patients and families. And these have been brought up usually in some of our sessions. And so we just wanted to make sure that more people were able to know about what's going on and the different resources and things that are out there. This is a webinar, so your cameras are off and you are muted. But we do want you to participate, so please, if you have questions, please put your questions in the Q&A box down, usually at the bottom of your screen. You don't have to wait until the end of the session. Please, as soon as you think about it, put it in the box, and we want to be able to address all questions at the end. So I will turn it over to my colleague Ashley for introductions.
Hi, y'all. My name is Ashley Varner. I'm, as Alice mentioned, I'm also a clinical social worker here in the Cognitive Neurology Clinic. And we are really fortunate today to have back by popular demand, Ginger Reagans, who is the Consumer Information Services Manager for the Atlanta Regional Commission and has a wealth of experience and knowledge, and is going to talk to us today about what the Atlanta Regional Commission can provide, as well as a little bit about how that works and what the state can provide, different resources that are available, and kind of give you the ins and outs. So I will turn it over to Ginger.
Wonderful. Thank you so much. Hi, everyone. I'm so excited to be here with you all. Thanks for the invitation. I'll tell you, this line of work, it is my passion. I get really passionate about the topic of helping people in our community. We have a lot of services that we're going to talk about today that I hope that I can educate you more on what's available in the community. So I am going to start sharing my screen and we will get started with the presentation. And I look forward to questions. All right, can everyone see my screen? All right, it worked. Yay. All right, yes. Yes. All right. Hi, Jenny.
Hi, good to see you.
Good to see you too. All right, here we go. All right, so again, my name is Ginger Reagans, and I'm here to talk to you a little bit about the Atlanta Regional Commission's Area Agency on Aging, and specifically about the Aging and Disability Resource Connection. And here is our slide page to kind of tell you what our vision, our mission, our values, and our goals are. We just went through rebranding, and our new vision is one great region. All right, so what is an ADRC? Well, that famous acronym stands for Aging and Disability Resource Connection. It's part of the Area Agency on Aging. We serve kind of as the entry point to long-term care supports and services. I like to think of it as a front desk for older adults and individuals with disabilities, caregivers, you know, anyone who might be in need of services, that they could call that front desk at EmpowerLine and get those services. We're not a place or a program, but rather we're a coordinated system. We like to collaborate with other partners because we want to streamline that access to long-term care. There is a phone number here that you can call. It's statewide, and it will route you to the appropriate Area Agency on Aging. And there's even a website, georgiaadrc.com. You can learn more about what the Georgia ADRCs do here in the state of Georgia. And then, of course, nationally, there are area agencies on aging nationwide. There's over 622 in our country, so that's a lot. Here in Georgia, we have 12, but in New York, you have 59. So every state is different. It's it's not a one size fits all. We all kind of tailor our resources to those in our state. So nationally, you can always go to usaging.org or eldercare.acl.gov to put in a zip code, and it will search for the area agency on aging in an area you might need. For instance, you might have a friend or a parent that might be in California, and you want to tell them all about this great resource of the area agency on aging, and you just plug in a zip code and it will give you that area agency on aging information that they can contact. So here in the Atlanta region, these are the counties that we serve: Cherokee, Clayton, Cobb, DeKalb, Douglas, Fayette, Fulton, Gwinnett, Henry, and Rockdale counties. So those are the counties that we cover here in the Atlanta region. And Empowerline, that is our Atlanta ADRC. We have a wonderful website. It is robust, full of information, and it's at empowerline.org. I encourage everyone to go visit. They have blog posts. They have information about different services. You can even search for services on there. For instance, you might want to know about transportation in Cobb County. You can go to the self-serve feature and just plug that in, and it'll spit out a data report to show you what's available in Cobb County. So that is all free and accessible through empowerline.org. And through our ADRC, we offer a couple of things. We offer information and referral assistance. We offer ePro resources. That is where someone will call in and want additional resources, and I'll talk more about that here in a minute, but we can generate different reports. We do intake and screening for the non-Medicaid program, home and community-based services. We screen for the elderly and disabled waiver program, the CCSP program. We screen for assistive technology. We host BRI Care Consultation. That's a caregiver support program. We've launched a free online educational tool through TrueAlta, and we even have some evidence-based programs. And throughout this presentation, I'll talk about each heading there, but I just kind of wanted to give you an overview of some of the things that we offer here at the ADRC. But the most important thing here on this slide is our website, empowerline.org. I just encourage everyone to go there. It has a lot of great information. There's an online resource directory under access to services, just lots of great information. So for what we do under the information and referral assistance, we have AIRS, certified counselors, that are answering the phone, that are helping individuals who are calling in looking for services, and they also screen, they assess for what they might be eligible for. Fiscal year 23, we handled over 107,000 calls. That's a lot, folks. We tend to get anywhere from 150 to 200 calls a day for those that are in need and wanting help and how to navigate the system for long-term support. So we stay pretty busy. And then, of course, our ePro database. That's the extensive resource database that has more than 26,000 services. And this is unique here in the state of Georgia because we're able to plug in personal care homes, caregiver support programs, legal resources, housing, transportation, financial assistance. I mean, the list goes on. We have like a 2-page taxonomy of resources that we can access through this database. And so when someone calls in and they may need assistance with their utility bill, we're able to generate a report of financial assistance agencies that can help them. Or they may call in and want to know, are there some dementia support groups for spouses in Gwinnett County? And we can generate that resource list. So it's a tremendous resource database that we have access to. So, please reach out if anyone has any questions about that, or you want some reports generated. I can certainly do that for you. So why would someone call the ADRC? Well, first and foremost, they're in a current crisis. They may have lost their housing, or their utility bills are behind and they're going to have their power turned off. Or someone may have had a medical emergency and they're in the hospital and their loved one doesn't know what to do and they discharge home. Who's going to care for them? So that's, pretty much what we do is we deal with crisis every day from individuals in our community. And we try to kind of help them navigate that process, give them some resources and kind of build their confidence in how they can handle that crisis. A stressed caregiver calling for help. A lot of times caregivers are calling in and they're just struggling to juggle their parent and their small children and themselves. So we're able to offer some support through our caregiver support program. And then just looking for resources. We have some that call in that may have just retired and they're looking for retirement, I'm sorry, not retirement, but volunteer opportunities now that they have free time on their hands. So they want to know, are there some senior centers that I can go and maybe play bingo or go on day trips and things like that. And then they know they need help, but they just don't know what's available. So in this type of call, we just let them talk, just let them tell us what's going on in their life. And then we try to kind of narrow it down and how we can help and offer those resources. And what are the most common caller requests? Transportation, housing, in-home services, and caregiver support. Most all of our counties offer transportation, whether it be like for $1 a ride, $4 round trip, that sort of thing. But one of the obstacles that we see in people seeking transportation is it doesn't cross the county line. For instance, if you had somebody in Gwinnett that may be coming down to Emory and DeKalb, that transportation is not going to carry them there. So it is a struggle. And we do have to provide other, perhaps private pay transportation resources that can help them get to that doctor's appointment. So that is one of the struggles with transportation. And then, of course, housing. We have access to subsidized housing, independent retirement communities, apartment communities, that sort of thing. In-home services. Somebody may be looking for a home delivered meal or someone to help come in and help them with bathing. And then, of course, caregiver support. So these are the top calls that we get here at our ADRC. Home and community-based services. This is one of our most popular programs. It's non-Medicaid and it is funded with Older Americans Act. And because it's funded with Older Americans Act, the individuals must be 60 plus. That is the restriction for that program. Of course, anyone regardless of age who is diagnosed with Alzheimer's or a related disorder may be eligible for the Home and Community-Based Services program. Now, some of the services that they offer in-home are home delivered meals, homemaker, which is housekeeping, light housekeeping, personal care, that's to help with bathing and kind of getting around in your home, respite care, that's to the caregiver, and then, of course, case management. There's senior recreation at the senior centers, congregate meals, that's at the senior center, and then transportation, home modification, and adult day programs. I do know that it may not come until FY25, but there's some money in the pipeline for home modification. So we may see that program expand. So kind of be checking back with me about that because we do have a lot of need for older adults needing home modifications. And then, of course, the adult day programs. And how do you apply for home and community-based services? Well, you call us here at EmpowerLine at 404-463-3333, and we will assess them and see if they might meet that criteria. The screening may take 30 to 45 minutes to complete, but we'll have some answers for them at the end of that conversation. And you just give us a call and we'd be glad to help. But of course, remember that individual has to be 60 plus, or if they're under 60, they must have Alzheimer's or a related diagnosis. Elderly and Disabled Waiver Program. We get a lot of calls for this one because of the structured family caregiving segment to this piece, and I'll talk about that here in just a minute. But what is the Elderly and Disabled Waiver Program? It's community-based care, and it is an alternative to nursing home placement. It helps older adults who are functionally impaired to continue living in their homes and communities, because that's what we want ideally. We want individuals to remain in their home with help. Some of the eligibility criteria is there has to be a functional impairment caused by physical limitation. There has to be an unmet need. They may not be able to bathe or cook or transfer out of their bed to a chair. They must meet nursing home level of care. They must be Medicaid eligible or potentially eligible, and we help them with that if they're unsure. And they must have SSI for source. They must also have limited income and resources. So we really get in the nitty gritty of the eligibility piece for the elderly and disabled waiver program. Some of the services that are offered through EDWP is adult day health, alternative living, which is a personal care home, emergency response services, respite, structured family caregiving, home delivered meals, home delivered services such as skilled nursing, physical, speech, and occupational therapy, and then of course, home health aid assistance. That's homemaker and personal care. Now, the financial considerations, this is kind of, can cause a bog down in this program because a lot of people are not aware of some of the restrictions. So one of them is called Medicaid estate recovery. So if someone owns a home or a piece of property, Medicaid may place a lien on that home or property after the client is deceased to recoup costs that they incurred paying for the client's care. And so that's a lot to take in when you're talking to someone who is in need of services. But we have to let them know about Medicaid estate recovery. Now, there are some exceptions. The estate is worth less than 25K, or a disabled adult child lives in the home at the time of passing. And then there's an option where the client can transfer the home into their spouse's name if they are married. So there are some exceptions, but we do have to be upfront that if someone is calling in looking for EDWP, we do have to ask, do you own your own home? And if so, we have to let them know this information. And then cost share. A lot of people think I'm applying for Medicaid and now you're telling me I'm going to have to pay Medicaid. Yes, unfortunately. It's based on income and it is dependent on whether the client is married or not for spousal diversion. For a single individual, the cost share is all of that income above $914. So if we had a single individual to call in looking for these services, and let's say they made $1,114, well, we would have to tell them you would have a $200 cost share. And a lot of times people will say, I can't afford that because I need every dime to pay my rent and my groceries and utilities. And we understand, but this is the policy through this program. So a single individual, anything over that $914 is considered a cost share. But if somebody is married, they may meet requirements to have spousal diversion where they don't have a cost share. And that formula, it's a little complicated. So it will take us some time to work with that couple to determine if they are eligible for spousal diversion. Assets has to be $2,000 or less for an individual. And then of course, the combined asset limit is $150,620. Client can transfer any of those assets above $2,000 to their spouse. Of course, investments accounts, life insurance policies, and savings accounts can all count as assets, but they can be spent down. Disability determination, we are getting a lot of those where an individual is under the age of 65 and they have had a life event where they can no longer work and they need services. However, they do not have a disability determination. So we're referring them to the Social Security Administration to get started on that paperwork. And then once they have that disability determination, we ask them to call us back, and then we can talk to them about screening. Of course, all of these financial pieces, somebody may have more questions than we may know answers to, especially the Medicaid estate recovery. And we route them to Georgia Senior Legal Hotline or Atlanta Legal Aid, or some of them may have their own elder law attorney. So we always refer them to legal resources if they are just unsure. Because sometimes somebody may say, well, I owned a home, but I transferred it to my daughter 3 years ago. Does that still count? Well, yeah, it does, because Medicaid has a 5-year look back rule. So, and they may have a penalty before they can start services. So that's why we send them to legal resources and they can help them navigate that challenge. But as you see, there's a good bit of financial considerations to take into account for the elderly and disabled waiver program. Structured Family Caregiving Program. This is why EDWP has become so popular. Both the caregiver and the care receiver must be at least 18 years of age. The caregiver must be related to the care receiver by blood or marriage. Now that marriage is a little tricky because we get a lot of calls from spouses wanting to be a paid caregiver for their husband, but a spouse is not eligible. What they mean by marriage is it could be a sister-in-law, a brother-in-law, or a cousin, but it cannot be a spouse. They must live in the same household with the care receiver under the same roof. They can't live next door or down the road. They have to live in the same house. They must be willing to work with the agency's health coach, and they have to submit daily care notes electronically. The caregiver may not have any other form of employment, and they cannot be the legal guardian, conservator, spouse, or parent of the care receiver. And the care receiver must require 5 hours of direct care daily in order to qualify. And this service is only available through SOURCE and CCSP waivers. So structured family caregiving is where that caregiver, if they meet all of these requirements, can be paid to be that caregiver. We're seeing the salary income for that caregiver ranges anywhere from $15 to $1,600 a month. So it's not a whole lot, but it's better than nothing. So we do get a lot of calls where caregivers are wanting to see if they're eligible. But we do remind these families that EDWP is primarily for that client who needs the services, and they have to apply and be eligible and be approved before structured family caregiving will start. Structured family caregiving kind of starts at the end because first and foremost, it's all about the client getting approved for Medicaid and for them determining the services that they need. So just remember, structured family caregiving, it's for paid caregivers, but you have to meet a lot of different criteria to be eligible. So how does somebody apply for EDWP? I've got a couple of ways here. You can go online to our website and click on the quick screen assistance and fill out the referral, or you can just give us a call at EmpowerLine and we'll be glad to do the screening over the phone. And of course, that screening takes about 30 to 45 minutes. Unfortunately, we don't screen for SOURCE. That is done by individual SOURCE case management agencies. We just screen for CCSP under the Elderly and Disabled Waiver Program. And now I wanted to talk a little bit about assistive technology. I'm really excited about this program because we do help so many people to stay in their home. And for those of you that may not know, assistive technology is an item or a piece of equipment that is used to increase, maintain, or improve the functional capabilities of individuals with disabilities in all aspects of life. And of course, it can range on a continuum from low tech, like a walker or a bath bench, to high tech, where they can use their smartphone to turn their lights on. The eligibility requirements for this program is the individual must be 60 plus, and a disability determination is not required. So we're able to help a lot of people through this program, and it's not that expensive. We may have someone that's calling in with arthritic hands and they're not able to open up jars, and they're having to wait for a neighbor or a loved one to come in to open that spaghetti jar. Well, for $18, we can order a Robo Twist jar opener, and it's a device you set on top of the jar, press a button, and it's going to open up that jar for them. There's just so many different things that we can help them with. Even the Joy companion pets, I'm sure you all have seen those. They're the battery operated cats and dogs, and now they have the birds that can interact with the client. You know, if they may have had pets in the past and can no longer care for them, this is a good substitute. We have access to these eating utensils where someone who may have Parkinson's and have those tremors, these particular utensils are weighted and they try to level out the tremors where you're able to feed yourself instead of getting the food on you. The goal is to get food in you and not on you, and these weighted utensils do the trick. So we're able to talk with individuals about their need and kind of assess it and then go from there on what we're able to do for them. If it's something complex and maybe out of our range, we team up with Georgia Tech Tools for Life. They're a great partner with us that we reach out to a lot for assistance. And I wanted to mention just a couple of things on the continuum there. Again, low tech can be a walker, a manual wheelchair. Mid-tech can be a book light or switch-operated small appliance. High-tech can be, of course, your laptop, your iPad, anything like that. Now, some of the things that we do not cover through our AT program here are grab bars. That is the number one thing. We do not recommend the grab bars with the suction. Those are not reliable. And the grab bars that we would recommend would be the ones where a contractor is coming into your home and affixing them in the stud of that wall. But we can't pay for that. We don't have enough funding for that, unfortunately. But we can certainly refer them out to home modification agencies if they're interested in that. So we do not do grab bars. We don't do standard walkers, bedside commodes, a 3-in-1 commode, wheelchair, lifts, like a Hoyer lift, hospital beds, ramps, stair lifts, lift chairs, that sort of thing. We refer most of these requests to FODAC, Friends of Disabled Adults and Children, because they're able to kind of help them with the commodes, walkers, hospital beds, and lift chairs, that sort of thing. Now, some of these things are eligible under Medicare, and so we will counsel the client to work with their provider to get a DME prescription for a hospital bed if they meet the requirement. A ramp, we have agencies that we can refer people to contact to get that ramp built into their home. BRI Care Consultation Program. This is our caregiver support program. It's free, it's on the telephone. We are talking to these caregivers monthly just to talk about the challenges they may be experiencing and how we can help them navigate those challenges. It's ongoing support for about a year. We do have some that we've extended out a couple of months because there may have been an extenuating circumstance to occur where they needed to stay on the program for us to kind of help them navigate through that challenge. So it is just a wonderful program. We actually have a little bit of a waiting list, but that's okay. We just hired a new person to join that team. So we're hoping to get that waiting list down and add more people in. But I can't say enough about the program. It's through Benjamin Rose Institute on Aging, and it just has such a wonderful, compassionate curriculum of how we can help caregivers manage this support. And we also kind of do a little bit of mediation sometimes with families where you may have a sister taking care of a mom, but yet the brother may not like how the sister's taking care of the mom. And we can kind of jump in and kind of help both of them to kind of come together and concentrate, on the mom. Let's kind of put maybe some personality differences to the side and concentrate on the mom. So this program really works well with families, and it's evidence-based. Now, I mentioned earlier we had partnered with TrueAlta. It's a free online educational tool, and I love when I can say free, but it's a tool that you can just go in, sign up, and you have a whole wealth of information that you can access. They have in there some videos about how you have that challenging conversation with your parents about stopping driving, maybe how you need help with bathing, that sort of thing. So it's all very interactive, and you can log in at midnight and go through these videos, whatever works best for you if you're too busy for a phone call from a care consultant. This is just a program that you can go in and navigate on your own. And of course, it's free in our region, and I've got the counties listed there, and I have the website that you can hop onto, but it's empowerline.truealta.com. So I encourage everyone to sign up. It's free. And then, of course, our evidence-based programs. We have several coaches here that offer these programs out in the community. They were virtual, but they are now getting back into the community and doing it at some of the local senior centers. There have been some at some of the churches, but it's healthy changes for living with diabetes, powerful tools for caregivers, healthy changes for living with chronic conditions, and a matter of balance. I know they're working on Tai Chi as well. I used to teach Tai Chi and I loved it. But these are all evidence-based programs to help you all to give that information out to your clients to let them know that these are free services out there that they might be interested in. And there is the phone number that they can contact them. And then of course, here's my information. I've got my email address, and then of course the EmpowerLine number. So I know I kind of go through kind of fast because you kind of get on a roll and you get passionate talking about these services, and I can give you examples from every aspect of these resources. I just love what I do, and I love the ability to come to you all and kind of share what we're going through with some of these challenging times. We thought after the public health emergency that maybe calls would back off a little bit, but they haven't. They've increased. Like I said, it's 150 to 200 plus. One day we had 300 calls and we were completely overwhelmed with that. But that just shows you the need for services in our community. And we're just trying to do the best we can to help navigate that. All right, Ashley, I think I've talked enough. I want to hear questions. How can I help you all in what you do?
Folks,
I'm going to stop the sharing.
If you have questions, that was a whole lot of information. Ginger, you're always so good at consolidating what just the wealth of services that are available from the state, and that folks they don't get advertised a whole lot. So
no, it's surprising.
If folks have questions, I know one of the questions that I get from folks is, what's the difference between EDWP and CCSP?
Yeah. So EDWP, Elderly and Disabled Waiver Program, that is the umbrella for CCSP and SOURCE. It used to be just CCSP and SOURCE. CCSP could be anybody that was eligible. SOURCE was somebody who was SSI only. Well, now they've merged those two programs under the umbrella of the Elderly and Disabled Waiver Program. So here at our ADRC, we are only screening for CCSP under the Elderly and Disabled Waiver Program. But if somebody calls in and they have SSI and they are not interested in CCSP, we will refer them out to SOURCE. And you might ask, well, now why would somebody not want CCSP if they're calling you? Because of, they may have SSI. Well, back in the day, SOURCE did not have a wait list, and they went through really quick. It's just a lot less red tape to go through SOURCE because that individual already has Medicaid. So it moves a little quicker. So if somebody's calling us with that, that's where we want to route them, because we want them to get the services as soon as they can. For CCSP, it can take 60 to 90 days to get those services, because you have to complete a Medicaid application. And then you've got to provide, oh my gosh, so much documentation, like a year's worth of bank records, pay stubs, if somebody had been working prior to being injured, that sort of thing. So, so that's kind of the difference. Elderly and Disabled Waiver Program is the umbrella, and CCSP and SOURCE are under there. SOURCE, SSI, CCSP, it's pretty much anybody. So yeah.
Thank you.
That's a popular question.
Ashley, can I ask something real quick that relates to that question? So
yeah.
If we have patients and families that we have knowledge of, they're on SSI, they have Medicaid already, where should we direct them instead of directing them to call EmpowerLine?
Right. I can send you all a resource list of all the SOURCE agencies that screen for that program, and then you can just refer them to those agencies.
So when you say SOURCE agencies, what does that mean? SOURCE
intake agencies. They are case management agencies that screen for SOURCE. There's a list, I think, of 6 or 7 here in our region that will screen for those. So if you have a client who has SSI and they need in-home services, I would just give them that list and say, here is a list of SOURCE intake agencies. You can pick one of them and just call and say you're interested in being screened for SOURCE. And then they'll call that agency and that person will screen them for that. But if you don't have a list and you don't know who to send them to, just send them to us here at EmpowerLine, and we'll help them navigate that process.
Okay. And if we could get that list of those agents, it would be wonderful.
And I'll send the PowerPoint too, so you'll kind of have that. I'm gonna write myself a note, PowerPoint, and then SOURCE agency. Yep, I can do that.
Thank you so much, because just historically, I'd always just sent everybody to EmpowerLine. So
right. Because back goodness gracious, maybe 10 years ago, we used to screen for source and CCSP, but that kind of came out and went to other agencies, the source component did. And so a lot of people still think we do, because traditionally in a AAA, they do screen for all of those programs, but here we don't. We just screen for CCSP. Yeah.
So that dovetails with another question that has come in, which is, can you talk about what the difference is between what's available in Atlanta through that? Do all AAA, in other words, do all AAAs have the same resources available?
Yes, yeah, they have the same resources. They are screening for the non-Medicaid program, home and community-based services. They're screening for the Medicaid waiver programs. They have access to the ePro resource database. They have access to pretty much everything that we do. The only difference is funding. So here in the Metro Atlanta region, we may have more funding for transportation than maybe a rural county has. So we may be able to do more things, you know, in our region than that rural region may not be able to do. So we all have access to same services. It just is dependent on the funding for that region. Yeah. But I just always encourage individuals who, you know, live outside of our region, call that AAA, and they will, you know, walk them through what is available in their community. What I love about some of the smaller AAAs is they may know some of the landlords, that they may have an insight of an apartment that's coming up, you know, for rent next month. We just had a case like that in South Georgia, where we had it was such a sad story, where the person was moving down to South Georgia to be closer to their parent, but they couldn't live with the parent. It was discombobulating really what all was going on with that one. But we were able to put her in touch with that AAA in South Georgia. And that certified counselor said, "Oh my gosh, I know a landlord who just advertised an apartment. Let me connect you to." So that was such a testimony of that AAA. But unfortunately, here in the Metro Atlanta region, it doesn't work that way. We're too big. We're too big, you know. So I miss that small town feel sometimes. Yeah. Yeah.
Advantages and disadvantages both ways.
Yeah. We get more funding, but we don't have that small connection. Yeah.
Another question came in, Ginger. How do you determine the quality of the organizations you recommend? For example, in-home services or housing? Is there a rating system?
They have to be vetted. So that team is in my unit, ePro resource specialist, and she monitors resources for the whole state. So we are vetting these companies. They have to go through rigorous application. They have to be in business for over a year. They cannot have any Better Business Bureau complaints or any other type of complaints. So it is a rigorous vetting process. So we don't go to Google and say, "Oh, I'm just going to add this resource because it's here." No, they have to go through our process to be vetted. So we are secure in those resources. Now, some, let's say, personal care homes you may have seen on the news, where they were part of our ePro resource database because once upon a time they were a good personal care home, but they ran into some challenges during COVID, and there was a couple that were on the news. We're all seeing it on the news and we're pulling it from the resource database because we don't want to give that type of a resource out to our community. So yeah, we take that job very seriously in who we put in that database. You know, sometime we could have a webinar to just show you the database of what all's in there. I know we've talked about it for GMN, that it might be a great tool to use, but you all could have access, you know, to ePro.
We would love that. We've lobbied for that for sure.
Yeah, yeah. But you've got my contact. You've got my contact, so you can always just shoot me an email saying, "Hey, I need this." So sorry, Jenny, I didn't mean to cut you off.
Oh, it's okay. Ashley, is it okay if I ask another question? So Ginger, something that comes up a lot in clinic is that many of our families that are caring for their loved ones and are enrolled in probably mostly CCSP, and they're assigned to a home care company. And often we hear that they're having a lot of challenges in terms of having aides come out on time, coming at all. The quality of some of the aides coming out are challenged. We know the home care industry is super challenged, especially post-COVID. So I think we try to explain that and give some context. But when we have families coming to us directly as social workers asking what they should do to improve the quality of the care they're receiving, what do you think is the best answer to provide to them?
That is a challenge that we hear every day, where somebody's going to call in and say, I'm already on CCSP, but I have this horrible provider that's not showing up. What do I do? Well, we direct them back to their case manager, because what their case manager can do is reach out to that home care provider and investigate what's going on. Are you not able to staff? What are the challenges you're experiencing? And if it doesn't sound too good from that home care provider, then that case manager can rebroker those home care services to another provider that might be adequately staffed and can help care for that person in their home. So we just encourage families to have that open dialogue with their case manager. If that home care provider is not coming in and providing the services that they're supposed to, reach out to the case manager, let them know the issue they're having, and then they may have to rebroker those services to another home care provider. Now, we have had some cases where the case manager may not be as proactive as we would have liked.
That was my next question.
And at that point, that's where I get involved and I get a supervisor name and I'm passing that along.
And I can vouch for Ginger that she has done that for me before and helped me.
Yeah. So I will send an email or whatever we need to do. Yeah. And we've even gone to Jill Cromp. She's head of CCSP at DCH. We've even had to go to her on some cases. So yeah. I'm glad I read your mind there, Jenny.
Oh, it was great, because sometimes families come back and they say, I don't know who my case manager is.
Yep.
I don't feel comfortable talking to my case manager, or they've had a negative experience. So it's
yes.
Yeah.
And in that case, we're like, you need to talk to the supervisor and you need to ask for a case manager change.
Okay.
Everything can be changed. Some of these agencies don't like to do that because it's more work, but ideally we want a successful relationship for both the case management agency and that consumer. So it's in their best interest to do that. Now, if that case management agency, if that supervisor is not on the ball and wanting to do all of this, well, then they can rebroker case management agencies. Okay. And then we'll give them a list of other case management agencies that they can reach out to and say, I'm with XYZ case management agency. It is not working out for me. I want to change. Here you go.
Would they call in Powerline to make that change?
They wouldn't call us to make the change, but we could give them a list of the other case management agencies. And sometimes we kind of advise them that route, but we don't make that change. They have to do it on their own. But if somebody is calling with those issues, then we say, it sounds like you need to rebroker not only that home care service, but you need to rebroker the case management agency. And so we'll generate a case management agency list and send it to them and just instruct them to call those agencies to see which one they feel comfortable with. I mean, a lot of times you can get a lot in the first 5 minutes of that phone call, and they may say, nope, that's not the one. I'm going down the list. So yeah, so just know case management agencies and home care providers can be rebrokered.
Great. I always try to empower our patients and families to take those steps, but I also want to make sure that I'm directing them in the right way.
Yes. Yeah.
I have one more question. Ashley, is that okay?
That's fine.
Okay. If somebody is on CCSP and using their waiver for home care services or adult day services, and they reach a point where they need to convert their waiver to a personal care home waiver, how does that work?
Case management, very easy.
Case manager. Okay.
Yep. Tell the case manager that you're no longer able to live in your home with these services, and it is time to move into a personal care home. So that case manager Now, it differs from agencies, but that case manager can do the paperwork to move them into a personal care home. They may know of one that has an available spot. But what I'm hearing is a lot of the case managers are just giving the individual a list to call the personal care homes and seeing what's available. Back in the day, that was a no-no, but things are changing post-COVID. So it's an easy switch. It's just a little bit of a legwork to find a home that has a spot, but the case manager will navigate that change in flipping the services.
Great.
And that's another thing we can do. If, let's say the case manager says, oh, I don't have a list, you just have to go out on your own to find a personal care home. They can call us and we can generate a list of personal care homes and send it to them to call. So you can see how we get all these calls, right? Because, you know, we just are trying to help everybody as best as they can because not everybody works together as a team.
Such a wealth of opportunities.
Thanks so much, Ginger.
Yeah, of course.
So important that our patients and their families know about it. Are there any other questions that folks have for Ginger before we finish up for today?
Yeah.
Sorry, trying to come off mute. Can you just say a little bit about who are appropriate referrals for the BRI program, and when we do encourage folks to call, who are they going to be speaking to?
I will send that information because we have a tip sheet and a
Oh,
flyer. So I will send that. But if someone is calling in and they're caring for like their mother, their sister, their spouse with dementia or Alzheimer's, we do have some that are non-dementia related. We are enrolling them into that program and just helping them through there. There's really no age limit there. It's just they have to be a caregiver in our region. Yeah, but I'll send that to you. Now, a lot of times we may enroll them and we're helping that caregiver, and then they determine this is too much. I can't do this in my home. I'm going to need to admit them to a skilled nursing facility. At that time, we would have to disenroll them from the program because they're no longer in the community, but we'll hang in there with them until it's complete because we don't want to just cut it off because we know they're going to need that support going through that process of
transition.
getting them enrolled. Yeah, but I'll send you some information there. One thing I thought of that I wanted to share, and I don't know if it was you, Jenny, or somebody else, but I know it happens with our MAC referrals a lot where we get these referrals or we get, you know, a call and we call them back and we leave voicemail and we don't hear back. And then of course I may hear from a social worker or from another agency, oh my gosh, you didn't call these, you know, these clients back and they're waiting. And I go into our database and I'm like, yeah, we actually left 3 voicemails and they didn't call back and we mailed a letter, you know, so, you know, I do want to let you know that. I mean, we're not perfect. We make mistakes because this volume is tremendous, but I can say 99% of the time we are returning those calls. It's just, I think sometimes these individuals are overwhelmed and they just don't, they're like, I can't deal with another phone call, you know, so that is a challenge.
It is, and the nice thing is that it's always there to reconnect.
It is, yeah.
Ginger, thank you so much. I don't see any other questions, so we'll finish up for today. But wonderful. I really, really appreciate you coming. It was a fantastic,
of course,
and I can't wait to have your slides.
Yes, I will send all of this information over to you shortly. And of course, reach out to me if you have any questions. That's what I'm here for. Okay.
Thank you.
All right, Ashley, look forward to seeing you next week. All right, bye-bye.
Thank you, Ginger.
Bye.
Bye-bye.